Good afternoon, ladies and gentlemen. First of all, I would like to thank you as the organizers that I can be here and present here. Thank you very much. I'm very honored. Now, if you look at the first picture that you see here, you might wonder what this means. And you see that the elephant is balancing on a ball. Do you think this is possible? I think this is Photoshop. But it reminds you maybe that many people think that addicts cannot remit without treatment. It's impossible. And I will lead you through some data, and I will start with data on alcohol dependence and drug dependence and come later to internet use because there is not much data about this. So what is the trick of the recovery, I would like to ask. And if you think of recovery, the first thing that you may come to your mind is treatment. And in fact, treatment is something that helps people to overcome addiction and helps people to get into a better life. And there are effective treatments like pharmacotherapy or like psychotherapy that helps people there. But on the other hand side, as you can see, there's a typical tip of the iceberg situation. That means most of those who have drug addiction or have alcohol addiction don't go into treatment. So in the case of alcohol dependence, it's about 10%. So most of all, we have to reach those who don't go into treatment. But what happens to them? So what is the cause of those who are untreated? If you look into the literature and look what books say, here's a book in the 1990s, and it's about treating adolescents' substance abuse, and the following is said there. Addiction is not self-curing. Left alone, addiction only gets worse, leading to total degradation, to prison, and ultimately to death. So there's only one way to go, and this is down, to rock bottom. Is that really true? So there came some evidence in the 1960s, the first evidence coming from studies that showed that in epidemiological research, the rates of alcohol and drug dependence goes down by age. So you have a decrease of the prevalence rates. There might be reasons for that. First of all, that patients or individuals went into treatment and recovered because of treatment. As you have seen, only a small number goes into treatment. So this is unlikely. The other thing might be that they die because of their alcohol dependence. Some do, that's true, but not all. So the figures showed there must be a third way. Then there were data about the Vietnam experience. So the veterans came back home to the US and they had drug dependence in Vietnam and they recovered. And just a few of them, about 4%, went into treatment. And if you compare those who were in treatment and those who were not, they do not differ with respect to the stability of the remission. And finally, there came some studies from the epidemiological field, longitudinal studies that showed there is a third pathway. And finally, we have very good data, and I will show you some data later. So what was concluded by some sociologists is there is something like an elephant that no one sees. So there are very much of those who are dependent who recover without treatment. So how big is this elephant? If you look at untreated recovery rates, you see that 72% of alcohol dependence people get out of the dependence without treatment. And we have even higher rates if you go into pathological gambling. You see 80% recover without treatment. Now I would like to show you some data from a longitudinal study from adolescents follow-up for 12 years. And here are the rates for natural recovery. So we have alcohol, 87%. We have 85% for cannabis, and here we have 95% for illegal drugs, and finally we have 99% for tobacco dependence. So it's clear that remitting without formal help is the predominant pathway. What gives people the ability to do that? What drives them and what makes that possible? So what you can see is that in studies done in this field that the negative consequences of drug dependence become more clear and there's some kind of commitment coming up. then social support is something which is very supportive or very important for remitting without treatment. And social support has something to do with the severity of the dependence. Those who have high severity need much social support, and those who have not can recover with less social support. So there are clusters of people who can recover without treatment. Then we have positive life changes. So changing drug dependence, changing alcohol dependence leads to better life circumstances or taking new role obligations, and that maintains the recovery. Now I come to internet addiction. This is something that was in the Brick Lane in London, so they covered the poles there not to get hurt if you look at your smartphone and don't care. So this is prevention, don't you think? But this is only a campaign, so it's not real life. If you look at the data that we have in the field of internet addiction, it's quite sparse. And I will look at only data that come from longitudinal studies, and this will a little bit echo what you heard before. So if you look at longitudinal samples, you have only a few studies, but you have some similarities. So what you find is that what you find is that the psychopathology is elevated in those who have internet addiction, so that are risk factors. And you find there are some familial and parental factors that are important. For example, not living with mother or having conflict with respect to internet use are negative predictors, are risk factors. And there are some other factors, but what is most important or more important in this field, what are the factors that are protective? And here you can see that there are not very much factors found so long, but the studies are in its infancies. But what you can see is that a good communication between parent and child is very, very important. And this is important for prevention as well. And what has also been found is that positive youth development is very important. So finally, I come to studies looking at factors related to remission. And I found only one study that showed that there are some factors that are important. And this study showed that low hostility is something that is good for remission, that is a positive predictor for remission. And they found that low in interpersonal sensitivity is good as well. Interpersonal sensitivity means that the people think too much of others' feelings and not of themselves. Finally, I would like to show some data that we conducted in Germany from a general population-based study. And we had a large study that we interviewed by telephone, and some of them had elevated levels of internet use, and they were re-interviewed very extensively. And what we did is that we used the DSM-5 criteria, and we had lifetime and past year diagnoses. And this enabled us to compare those who were remitted in the last year with those who were not. And these are the factors that differed between those. So first of all, please look at the data with respect to psychopathology. And as you can see, all rates are quite high. So more than 50% had substance dependence or substance abuse. But it's not different between those who remitted and those who did not. So this is no predictor. No predictor was a mood disorder, although very prevalent. It's between both groups not different. But anxiety disorder was a predictor not to remit. So having an anxiety disorder is a bad predictor or not a good predictor for remitting. Then we have certain personality disorders. They are divided in cluster A, B, and C. And as you can see, clusters A and B are important for remitting without treatment. And cluster A, for example, is schizoid personality disorder, or cluster B is a borderline personality disorder. We found no difference in ADHD, and we found no differences in impulsivity. But what you can see and what echoes findings from the substance use field is that the more severe the disorder was, the less likely a remission was. So this is the number of criteria fulfilled. And we have, again, social support as a positive predictor of remission, what echoes findings from the substance use field. This is the only question that had a really high impact, that could differentiate between both groups. It's a single question. It's, in the last year, have you ever been worried about having a problem with internet use? And you see the rates of those who said yes is double as high in the group who remitted without help. So what can we learn from these studies? First of all, what can we learn from the studies for the treatment system? So the treatment system is reactive. People come into treatment and we wait for them that they come into treatment. But we have to be proactive, that is, that we have to get in contact with them. You heard from Professor Saunders, getting in contact with alcohol abusers is to, for example, ask physicians to discuss alcohol with their patients. In the case of internet use or internet dependence, that this might be the case for teachers to do that or for parents to do that. If we have these kind of proactive intervention approaches, what kind of success do we have? We have a greater reach of persons, so all that don't go into treatment on their own. And secondly, we can shorten the period of a disorder, so we can have shorter periods of something that went wrong or went in the wrong direction. And finally, we can prevent that a problematic use comes to addiction and to severer disorders. Now, what can we learn from these studies with respect to the interventions that we do? Most of that, what is used for treatment, comes from those who go into treatment. But all the other knowledge that we don't have from those that do not go into treatment is not used yet. And this kind of research is still in its infancies, even in drug and alcohol dependence, the more in internet dependence. So I would like to sum up and give some conclusions. I would like to show you, or I wanted to show you, that recovering without treatment is a very predominant pathway, so very often happens. And these remissions without formal help have two great factors that influence them. One is the severity of the dependence. So the lesser the severity is, the more the remission probability is high. And on the other hand, we have social support, which can buffer some kind of having a severe problem. Then we have similar factors found for internet use disorder or internet addiction compared with substance use. And finally, we can look at the interventions that could make a change in the terms that we have early and proactive interventions, reach the patients early and give early interventions to them, so that the prevention of more severe disorders is guaranteed. And you have seen that there are some groups that are more vulnerable than others. And this is, for example, those who have comorbid psychiatric diagnosis. So this is a special group to be looked at, and this group is less likely to remit, as you could see. So that should be taken care of for this group especially. And the last point, you remember the question, have you been thinking about changing your kind of use of the internet, or were you aware of having a problem? And those who said yes had a higher probability to remit. So this is the case for talking to someone in the case that you have a problem with internet use. Or the other way around, you should approach someone who might have a kind of problem. And this could take place in schools, for example, or in other places where these target groups could be reached. So thank you very much for your attention.
Thank you so much, Dr. Rumpf.